So my name is Amanda Lanny, and myself and Bridget Blakely, we're both faculty members in the Drexel School of Education. We both teach in the Applied Behavior Analysis program. I also teach in special ed. And the secret is we're actually school psychs. So we kind of wear many hats in the School of Ed. And we both have backgrounds as like consultants for PBIS. And that's when we were, and Bridget will provide a little bit of background when she gets up here. But prior to me joining academia, I did PBIS consulting for about 10 years, and I've continued with that in different capacities and still dabble with it to this day. And I also now teach ethics. I teach the ethics course at Drexel, so it's kind of a merging of worlds for me. So that's what we're going to talk about, which I'll go over in just a minute. I do want to let you know this is a session that will qualify for ethics credits if you're a BCBA. So just fair warning, we're going to talk a little bit about behavior analysis and intersperse some of that language. If you're not in that world, that's great. We're a friendly group. We try and keep it as applied as possible. We just always need to link it back to like the ethics code. So you'll hear a little bit of that sprinkled in throughout the session. Okay, so you might think, what does ethics really have to do with PBIS? Well, anything related to PBIS, there's a whole lot of things that we do in PBIS that could present ethical dilemmas. Those could be anything from data collection, collaboration with colleagues, making sure you're progress monitoring accurately of your students, making sure you're implementing evidence-based practices, using data to make decisions, coaching, providing technical assistance. These are just a small sample, and then within each of these like bubbles is a huge set of activities and professional work that could occur, which you may be doing on any given day and can certainly present ethical dilemmas. What we're going to focus on today is we're going to talk about treatment integrity, but first we're going to start with collaboration with colleagues, because we know regardless of what role you serve on a PBIS team, whether it's tier 1 or tier 2, tier 3, you're one voice on the team, right? And so you have to be able to collaborate with others. And those individuals, those other members of your team represent, have potentially different professional expertise and represent a different voice and stakeholder within your team and within your school and district. So you need to be able to work together well, even though you think what you have to recommend is the correct way to go, not everyone else might agree. So we're going to talk we're going to spend more time likely on that today. So that is our plan for the day. We're first, again, because this is for ethics credits, we're going to provide a little bit of a definition just to kind of orient us around ethics and what we're talking about in terms of definition. And then we'll move into the collaboration with colleagues. And then we'll talk a bit about addressing issues with treatment integrity and talk about kind of what that means for treatment integrity. We are going, one thing I did want to mention during this session, we're going to take about a 5-minute break because this is a 2-hour session. So we'll take a break about an hour in. Obviously, if you need to take a break, do that at any point, but we'll take a break as a group in and around 11 o'clock. And during this session, we're going to embed a series of think about it, opportunities to respond, engagement activities. We're going to use Poll Everywhere. We'll certainly open it up for questions at various points during the session as well, but we're going to start with Poll Everywhere. If you're not familiar, it's really a way that you can use your device, whether your phone, iPad, laptop, whatever you have with you. If you can go to the website that's listed at the bottom of the screen there, I'll give you a second to bring that up. And then on the next slide, I'm going to activate our first poll. Okay, so I'm going to move to the next slide, but the website will be up there as well. But our first poll is a tough one. It's going to be, what is your favorite Hershey sweet treat? And if you're still attempting to join the website, it's up in the top left corner. Here, why don't you come up? Yeah. Do you want to do this?
And if you're on the website, if you see one that you want to vote for, you can vote for it and move it up higher on the list there. Or type in one that you haven't seen yet. Yep, you could do that too.
Looks like Reese's is winning the race here. That's certainly my favorite as well. Okay, Kit Kat's a close second. All right, these are important questions, we're here. And the gift shop is very busy, so yes. Okay, so this, as I said, we're going to be using Poll Everywhere kind of throughout the session at various times. So just keep this website open, please, throughout, and we'll return to it during the session. And with that, we're going to move on to our first topic.
Well, hello everyone, my name is Bridget Blakely, and as Amanda said, I'm on the faculty at Drexel University, primarily teaching in the ABA program, but have some opportunities to teach in school psychology program as well. But I have a long history with PBIS. Having worked in schools as a school psychologist, I worked as a high school teacher, and then had an opportunity to do a lot of consultation with schools trying to implement and really start off with PBIS. So when it was very, very new, we had the chance to really work with different schools. I worked in both New Jersey and Pennsylvania, helping schools to really implement the ideas behind PBIS. And I don't know how often I personally thought of the ethics of everything that I was doing with PBIS, but the more I study ethics, the more I think about PBIS, and the more I see it happening, the more I realize ethics really needs to be an integral part of it. So as Amanda said, we're going to really start off by talking today about ethics. Because it's such an interesting and fun, entertaining topic, I wanted to make sure we had the chance to really define it and understand where we're starting from. What's that starting point? So today I have two articles that I'm going to be primarily drawing from and summarizing. And these are recent articles, but I felt like they were a really good opportunity to see ABA ethics as it relates to what it is that we're actually doing. The first article I have for you today comes from 2021 JABA, and this is by David Cox. And the title of the article is Descriptive and Normative Ethical Behavior Appear to be Distinct. Doesn't that sound engaging? So we're going to talk about it. And the article starts off with this definition of ethics. Like, why are we even here? What is ethics? He really describes that in ABA, what we do is we're intending to break down complex behavior into its functional parts. And ethics itself is determining what's the right thing to do, what's that ethical decision-making behavior, and then omitting the behaviors that track to what is claimed as the right thing to do. So as behavior analysts, we should be able to connect those two things together, determine, what is the functional part of an ethical decision-making behavior, and how can we break it down into its functional parts. So he's really questioning, should we, as behavior analysts, be thinking about those functional parts, the pieces of the decisions that we're making and how we're making that decision to be ethical in that moment? Now, there have been many other authors and people who have theorized about ethics and how we behave ethically as a behavior. And in fact, there's been many people that have been able to demonstrate that ethical decision-making is actually operant behavior in and of itself. Okay, so there are, reinforcements that make sure we keep doing the right thing as we're intended to do. There's reasons, there's, clues, there's hints, there's prompts that encourage us to do the right thing along the way. The question is, though, what is ethical behavior? So this relates to the fact that how we make these decisions, what is the code, all of these things are important for us to be considering. But ethics are complex. It's not very easy to say this is absolutely the right thing to do every time. This is absolutely the wrong thing to do every time. And that's where things get a little bit complex. Cox tries to bring together philosophy and ABA. Again, it was a really engaging article. So he takes some of this philosophical terminology and he brings it together to talk about the discussion of ethical decision making. And he said that there's really no known research that empirically demonstrates the function of ethical behavior, why we do what we do. So he wants to do just this. He wants to determine the function, why it is that we do what we do. What we do know is that if we're going to be offering high quality consultation supports, if we're going to be offering high quality ABA support and services, we need to be doing this ethically. Ethical decision making is vital to what we do. Okay? And the more that we can learn about ethical decision making, maybe then we can make sure that we're setting the contingencies so that people are encouraged to continue making ethical decisions along the way. He brings in all kinds of terminology, things like functional ethics. Functional ethics is the description, prediction, and control of ethical behavior. And that's what we want to do. We would like to try and control ethical behavior so people are motivated continually to make the correct ethical decision. Ethics, when I learned ethics, when I teach ethics, I'm very often discussing this is what's right and this is what's wrong. All right? That's how ethics is approached. That's termed as descriptive ethics. Okay? The next step is, though, why is this the right thing to do? Why is this the wrong thing to do? Now, what is right and what is wrong, it's not written in stone. Right? It's often determined by society or by a culture. Right? So this descriptive ethics really comes and is reflective of what's happening in the culture around us. Normative ethics, though, is where we're going to dig a little bit deeper. It's a little bit different in that it wants to look at why something is right and why something is wrong. Now, in ABA, like I said, I've learned what is right and what is wrong. Nobody really digs into why it's right and why it's wrong. So ethics and ABA really merges together descriptive and normative ethics. It's basically the same thing. But we can apply an operant framework to the normative ethics, the why we're doing what we're doing. Normative ethics is verbal behavior, so it has the same operant effects as all other behaviors that we engage in. So Western academics have put together some different categories of normative ethics. So normative ethics could be consequentialism. So people do what they do because it's the right thing and it leads to the greatest happiness for the greatest number of people. That's consequentialism. So think about the decisions you make on a regular basis, PBIS-wise or beyond. Why are you doing this? Is it because it's going to lead to the greatest happiness for the greatest number of people? Or are you possibly doing it because it is conforming to socially derived rules that have been defined by the context? It's what everybody else is doing, so that's what we do. That would be deontology. And then the third category would be virtue theory, and this is when we look at some behaviors are right or good in and of themselves, regardless of the consequences. I'm going to do this because it's the right thing to do, regardless of what happens to me or anyone else around me. So these are the why, potentially different why reasons that we would do what we would do. Now in ABA, again, we have a code, right? And the code really guides us and tells us exactly what we should be doing. Ethically speaking, we have a framework that tells us what is the right thing to do. We are making these decisions, or we should be making these decisions because they benefit others, because it allows us to treat others with compassion, dignity, and respect, behave with integrity, ensure their competence. Really fun stuff. So Cox provided us with this lovely flow chart that's super easy to follow, but basically it's taking a look at this operant theory that defines our ethical behavior. If you can see here, ABCs are demonstrated overall throughout this. Ethical behavior is prompted by antecedents and it's maintained by its consequences. Whether we're looking at descriptive ethics or we're looking at normative ethics, this all applies. So it's pretty interesting to me because I never really thought about the ethical behavior in terms of ABCs of behavior, but they all really apply. There are things that really encourage us to do the right thing and or the wrong thing in the context of society around us. So I gave you all these super interesting terms, all this super interesting stuff, right? I know that you're super engaged. Why wouldn't you be? But should we really care? Should behavior analysts really care about normative ethics? Well, that's a good question, and that's what he was trying to answer in this article. In philosophy, normative ethics matter. They're important because when normative ethics, the why, come around, it tells us the what we should do. So normative ethics are required for descriptive ethics. Okay? So it makes sense that we should care in ABA about descriptive ethics. We need to know what to do. But should we care about the why we should do what we do? I'll give you an example, okay? Not necessarily related to PBIS, but let's think about working with clients or students who are somewhat challenging. So the article gives us this example, thinking about a BCBA who's trying to determine whether or not to use a punishment procedure in a treatment plan. Okay. It's always tricky, right? Punishment's a wonderful procedure that works well, but should we default to it? When should we use it? How often should we use it? It's tricky. If we take a normative ethics approach and we look at the different reasons why we might use punishment or not, right? A consequentialist approach might be, well, it's the right choice to use punishment because we're going to do whatever maximizes contact with reinforcers and reduces contact with punishment. So we need to use a punishment procedure up front so that there's opportunities for reinforcement on the back end. That might be a reason why I'm going to use this now. A deontological approach might say, we're going to use punishment because we're going to use whatever choice is going to fulfill the most rules in the code, and the code says that I need to use punishment when necessary so that I can reintroduce reinforcement. Right? So those are different reasons why we might make the choice or to use punishment or not to use punishment, depending on how you're reading those situations. But should we care as practitioners? Does it matter why we're doing what we're doing, or does it matter what we're doing? Well, Cox suggests that behavior analysts are trained to focus on the code, but it's really only the people who write the code who are concerned with why the rules exist. But should we do what's right just because someone told us it's right? I mean, not to suggest that the code is wrong, but think about that. The code has been given to us. We're supposed to follow it. Should we just follow it because that's what the code says? And should we consider the distinction between, just because it's never been considered in training of ABA, the distinction between descriptive and normative ethics, does that mean that we should never continue to consider the difference between the different things? Just because that's the way it's always been done, should we continue to do it that way? And not only that, but the code is great, but it doesn't apply to every single scenario. There's definitely times when you have to make interpretations and make judgments based on what the code has said. So maybe if we did spend more time with normative ethics, we'd have the opportunity to learn how to interpret that code in a little bit better of a way. So Cox decided he wanted to dig into this a little bit further, and he actually did some experimental treatments here. So he did experiments, 2 of them, in fact, to try and answer these questions. And his question was, does what, let me try and rephrase it. Does what behavior people consider as right or wrong rest on why these same people think that that behavior is right or wrong? Right? So does right or wrong depend on the contingencies surrounding them, right? If I think that that's right and you think it's wrong, do we actually agree on why we think it's right and wrong? Does the why matter in determining what is right and wrong? So we did 2 experiments. He used graduate students to answer some vignettes and determine what they would do moving forward. So very low stakes, not talking about actual kids, but it was interesting to see how they determined what they should do based on the information they've been provided. They were given 2 choices, and what should you do? And then they were asked a second open-ended question. So I thought it would be fun to do the same thing here today. So what I'm going to do is I went and looked at the vignettes he offered to the graduate students, and I made it a little bit more PBIS appropriate. Now, keep in mind, I'm going to show you a scenario. We're going to think about it. You're going to answer what you would do based on what the vignette, the details have been given. It's an ethical scenario. There's no right or wrong. And also, you're going to be answering on poll everywhere, so I won't be able to tell what answer you provided, so don't worry about that. But it's just an interesting, approach to what is normative and descriptive ethics and how can we actually apply it in real life. So here's your first scenario. All right. You work with a teacher who's attempting to implement a Tier 3 plan for a student in her classroom. Child's a 6-year-old boy with autism. He has no other special education services or behavior concerns. You completed a functional assessment. You identified the controlling variables for the child's target behavior. In your opinion, the best data collection system for gathering baseline data would require daily entries by the teacher. A data collection system has been designed that's easy to understand and score. However, the teacher does not take data, despite your best attempts to prompt and reinforce her data taking. This child really needs help, but without data, it's going to be hard to provide treatment. Now, should you terminate services? Nothing you can do without data. It's really hard to do any implementation here. Or should you continue providing services despite the fact that you don't have data to use to make your decisions? So go ahead and answer. Just give you another 30 seconds there. Seems to be a landslide winner here, okay? But that doesn't necessarily mean one's right and one's wrong. Let's think about it a little bit further. Whatever answer you provided, why was that the best choice? Okay. So we're going to do another poll everywhere. You're going to type in your answer. Again, you can vote for one that's already listed if you agree with what someone else has already stated. But why, regardless of what you said, you don't have to tell what your answer was, why was that the best choice? You can keep typing, but I'm going to start talking a little bit. So it's interesting. Like there was a lot of agreement on what the right thing we should do, but there seems to be a whole lot of different reasons why we should do what we do here, right? So we should do it because the student still needs services. I'm on the wrong slide here. We should do it because we have an obligation. We should do it because we shouldn't do it because We can't do anything without good data, I saw someone type. So there's a lot of reasons why we're doing what we're doing. Does the reason why matter when we move forward? So I kind of, did some predicting, some mind reading, and I thought that this might be the three main reasons, overall summative reasons why people made decisions what they did. Because the client's going to have the greatest opportunity for preferred outcomes if there's sufficient data. So we have to keep working with them because we want to make sure they're getting the right data to get the best outcomes. Or we're going to stop working because they don't have enough data to give them sufficient outcomes, whatever the case may be. Because PBIS requires data to reach the outcomes, it's necessary the teacher collects data. Or because the best option for both the the teacher and the student. The student is going to benefit from having data to analyze, and the teacher will learn a beneficial skill of data collection if we continue working with them.
So what, did you give the answer, or are these I'm confused?
So those are the answers that you guys provided.
Right.
These generally were the top three answers that came out of Cox's article and his study. So it's not, the answers that you provided are pretty much similar to what the participants provided as well.
So was the answer to, these are the comments, was the answer to continue services?
Oh yeah, they were mixed. There wasn't a lot of agreement on that. So
They disagreed more than we did?
yeah,
Okay.
yeah, a lot more. I'm sorry about that.
No,
Yeah,
okay.
good question. But coming back to like the why, right? What should we do and why should we do it, right? There's different reasons why. So everybody was coming from a different starting point about why we should make the decisions that we should make based on, the information that's been provided. So does the why matter? And does it affect the what? What I did based on where I was starting from. Right. So I should say, yeah, so there were, I believe, 5 vignettes that the students looked at, and he summarized all the data. So I wasn't able to look at individual questions to be able to directly compare your results to their results. But generally speaking, he found that there was a lot of agreement in the what and not a lot of agreement in the why. So how can we, as ethical behavior analysts, as trainers, as supervisors, how do we make sure that we're encouraging the right thing to do, even though we're all coming from a different why? And that's the question that we're asking. And does it matter? So he wanted to take it a little step further. Could we see more agreement if there were some manipulation to these vignettes, to these scenarios? If we took one minor change, would it make a big impact on the overall outcome that he was providing? So let's try it again, okay? So in this scenario, very similar, working with the teachers, trying to implement a tier 3 plan, right? Same reason, behavior concerns with a 6-year-old boy with autism. You completed a functional assessment, identified the variables, you need data collection, should be happening daily. Data collection's been designed, however, the teacher has difficulty implementing the data collection system. You have only 2 hours per week to work with the teacher to help her improve. But by spending more than 2 hours per week with the teacher, you could get her collecting accurate data, baseline data within a month. If you just spent that extra time, you could get the data to happen. The extra unpaid time required each week, it's going to end up being an extra 30 minutes that you're going to have to spend to get the best outcomes with this teacher, but it's going to come at the expense of the time that you're spending the rest of the students on your caseload. Okay? So now at this point, should you start to allocate more time over the next month, or should you only allocate the time that you already have scheduled together? So we're a little bit more split here. right? And chances are we're all coming from a different place, a starting place. How much is on your caseload? How far apart are the schools you're working with? How far apart are the classrooms that you're working with? All of these things matter, and all of these things would impact your decision on whether you can find those extra 30 minutes. What if I were to change that 30 minutes to an extra hour, 2 hours? How does that impact your decision making overall? Right? So we all do the same thing. We're all working together. We're all there for the benefit of our clients. But there are some things that are difficult to determine whether or not we are ethically obligated to move forward with this, or ethically we have the right to step back and take a different approach to it. So it was interesting, the article and the approach that Cox took to this. And obviously looking at a vignette is very different than looking at real life. We don't know for sure what the rest of your caseload looks like. We don't know for sure how much time everybody else deserves. We don't know all of those things. They all matter. They all come back to the why. Not just what you're doing, but why you're doing it. So we have to keep that in mind when we move forward. When we think about what decisions we should make and how we can best impact our students and the teams that we work with, taking all of these things into consideration, not just what you're doing, but why you're doing it, could absolutely impact how we move forward and also the outcomes that are available for our students and clients. Ethical behavior is still going to continue to be variable, right? The code is there, but the code is there as a guide. So our behavior is going to vary based on the different scenarios, the different situations that arise. One area that is pretty common, especially in PBIS, that absolutely is impacted by both descriptive and normative ethics is this idea of collaboration. Okay? It might be interesting for us to think about this. It might be, and it also is going to be, something interesting to think about in the next portion of this presentation. Not just how and when to collaborate with colleagues, but also the why. Why would we make this decision versus this decision based on the code and the information that's surrounding us in this specific situation? So the next article I'm going to jump to right now comes from Matthew Broadhead. This was published in Behavior Analysis and Practice in 2015. Title of the article being Maintaining Professional Relationships in an Interdisciplinary Setting, Strategies for Navigating Non-Behavioral Treatment Recommendations for Individuals with Autism. Fascinating stuff, right? So I mentioned that this is helpful to think about the where and the why, but it also gives us a very practical, strategic approach to scenarios and working with PBIS teams so that we can all benefit everybody together. Keeping in mind that the fact that we are very much guided by an ethics code that should be really encouraging us to behave in a specific way. But when it comes to real life with your feet on the ground, things can look a little bit different from time to time. So let's start off with the fact that we're all working on a team, right? Okay, that's one of the best parts in my mind of being part of PBIS and MTSS is you get to work as a team. Lots of different voices, lots of different expertise, bringing everybody together for the same goal of helping your clients and students. So let me know who's on your team. Okay, so here you go, poll everywhere. Tell me who's on your team. What kind of professionals are you working with? And again, you can vote for an answer that's already been provided. All right, so I was watching the answers that are coming in. Lots of teachers on teams, which is great. We see counselors, social workers, special education teachers, principals, administrators, school psychologists. Lots of different philosophies, lots of different backgrounds, lots of different variable expertise coming into these teams. Always an opportunity for benefit from that. So generally speaking, PBIS teams, MTSS teams consist of multiple disciplines, people coming from different backgrounds, various training scenarios coming into this all together. So the why looks very different depending on everybody's backgrounds and where they're starting from as in terms of the decisions that are being made. Despite the fact that we're all coming from different places, it's very common when you're first starting off that we're all speaking a different language. Right? So I teach in the ABA program, and I teach a course specifically on consultation, and we talk about this, the fact that everybody's speaking a different language. Different, however, isn't wrong. Different is different. So how do we learn to speak each other's language so that we're all there for the benefit of our students all together? And that's where collaboration comes into play. Now, collaboration, it's a tricky term because it, again, has different definitions based on where you're starting from, right? Your why and your where. It's going to give you a different definition, a different understanding of what collaboration should and can look like. So for the purpose of this presentation, we're going to focus on these specific definitions of collaboration. Very basically, engaging in professional activities with another related service provider with the intention of improving treatment outcomes. All right? I think that's pretty basic. I think that's basically what we all do in all of our teams. I don't see anybody completely opposed to that definition, so we're going to go with it. Sounds good, right? Oftentimes what it means is that we are working as a consultant, which means that we're trying to offer, and everybody's working as consultants with each other in that collaborative relationship, trying to bring our own expertise together in a way that everybody's going to benefit. However, with consultation, it means we're all there voluntarily, interacting with interpersonal skills, and this is going to mean at least two professionals. We need to be making sure that we're using communication modalities of all different forms. This means meetings happen face-to-face, in email, all that wonderful Zoom stuff and all. In the end, with collaboration, we are having shared decision-making and shared problem-solving towards a common goal. We all have this common goal. We're trying to get to the best outcome all together, and we're making decisions communally, not in isolation. Well, the ethics code, the ABA ethics code, tells us we have to collaborate with our colleagues. We have to collaborate. This is the exact code, the standard that comes from the code 2.10, collaborating with colleagues. And it means that we have to collaborate with colleagues from other professions for the best interest of our clients, our students, our stakeholders. Okay? There's likely to be conflict in the way we decide to approach things. But according to the code, we have to be working on compromising when possible, but always prioritizing the best interest of the client. Behavior analysts document all outcomes, all actions taken in these circumstances, and their eventual outcomes. So what do? When we think about collaboration, we think about working with our team. Obviously, we're going to start off with trying to address these goals, right? We're going to do this together where everybody's individual strengths are brought together so that we're all stronger and united. A lot of benefits to that. First benefit, obviously, it's going to benefit our clients, our students, to the greatest extent possible. But there's also this extra component where we get the opportunity to promote the field of ABA to the rest of the interdisciplinary team. And I think that's where things get a little bit tricky. We have this intention to collaborate with this desired professional interaction. We need to maintain respect for everybody around us, understand their perspectives, and appreciate the fact that we're all bringing in something new to make the best outcomes for our clients, for our students. This is going to require us to use our best interpersonal interactions. Not the ones that I'm going to use when I'm driving home on the turnpike today in traffic through Philadelphia, but the best interpersonal interactions altogether. This is required of us as behavior analysts. It's required in the task list. It's required in the ethics code. right? It's absolutely required. And in the end, this is going to give us the best opportunities for everybody around us. However, there is not a lot of research or a very structured understanding of what exactly is a beneficial interpersonal interaction. There's just very limited research in what is good and what is bad, what's effective, what's ineffective. This is hard because it's hard to teach someone the most effective way to interact with their colleagues from other professions and other backgrounds. It's also hard to make sure someone has fully learned it because we haven't really applied a strong, consistent definition of what this actually looks like. So then it comes to the fact that we're in meetings all the time and we're providing different ideas and suggestions on what we can do moving forward as a PBIS team to make the best outcomes for everybody all together. We're going to get a lot of suggestions. And as behavior analysts, we are there to compromise. We're also there to promote our field. We're also there to listen to everybody together. So what happens when a colleague introduces ideas that are non-behavioral? How are we ethically obligated to move forward? And not only that, but how is our reaction going to affect our ability to collaborate with the rest of our team? And how is it going to impact our invitation to continually work together with this team for the benefit of everyone? So I have an example of what this might look like, for better or worse. And this, again, comes from the article. Not exactly PBIS oriented, but let me give it to you here. Example of a BCBA who is working in an interdisciplinary team. Okay? During the first month that the BCBA is there, the BCBA is frequently questioning the treatment recommendations of other non-behavioral members. Well, what data supports that idea? How about I offer another way to try and do that? What's going to happen? How is that going to be received? Every time you offer a suggestion, somebody's questioning the validity of that question. Is that going to make you love this opportunity to work with this person? Probably not, right? And chances are that BCBA is not going to be invited to future meetings, right? And so before I was a BCBA, I was a school psychologist, and I was in those meetings with BCBAs who were continually asking these questions and making me think this is really hard to work with you. You clearly have one idea in mind, and you're not really willing to budge. So that's difficult. Recognizing now, according to the ethics code, the BCBA has to really push for those ideas, ethically speaking, according to what the code has said. However, do they? So this article is really looking at that idea, right? How can we make sure that we're handling these non-behavioral suggestions in a way that's collaborative and doesn't just immediately shut down the idea from a different perspective? We need to make sure that there is a systemic way to approach this. We don't need to make sure, but the Broadhead article decided that this would be a valuable use of time to put together a structured, systemic way, a strategy that we can follow so when we're faced with these non-behavioral treatment recommendations. If we follow this, it's going to allow us to make sure that we're advocating for the client, becoming familiar with a new treatment, but also taking the perspective of a non-behavioral colleague and analyzing the treatment's potential negative effects. Here it is, lovely decision tree. The idea is, when do we stand up and raise our hands and say, no, not comfortable with this, we need to move on? And when do we say, okay, we can try it. Okay, let's give it a try. All right? And this decision tree, these steps in this that we're going to go through right now are going to help us recognize how to collaborate effectively in a very structured, systemic way. Okay. A few assumptions about the effect of this decision tree. First of all, this is coming from the background that we are behavior analysts. We're working with interdisciplinary team, and there's a non-behavioral colleague who has proposed a non-behavioral treatment. We also are assuming here the BCBA is adequately trained under adequate supervision to provide services within the interdisciplinary team. The BCBA has a role in the team that affords them the opportunity to evaluate and comment on the treatment, and that consent's been provided for the non-behavioral treatment that the BCBA is analyzing. Okay. So we're going to roll through these steps here. In fact, before we begin these steps, it might be a good time to take a break. Yeah? Okay. All right, let's take a 5-minute break here, and then we'll roll through the actual steps. So I have 10:47 on my phone. So thanks for returning. We have a lot more to cover as far as the code and how to move forward. And I know I've been throwing these terms around, the code and the BCBA and non-behavioral. And thank you all for coming to me, and I'm happy to provide a little bit more context. So if I ever use a term and you want some more context, please raise your hand. I'm happy to offer that. Like we said, this is a presentation that's going to be available for BCBAs to earn credits. So that's why we're deferring to the code as much as possible, because that's what we have to do in order for them to be able to earn credits. So what is a BCBA? A BCBA is a board certified behavior analyst. Okay, so there's likely behavior specialists in your schools, and lots of times the credential that they need to have that job is a BCBA. That's a master's level credential, and it's someone who is becoming an expert or has expertise in the field of behaviorism. Think back to Psych 101, B.F. Skinner. Remember that guy? All right, he's my B.F. Skinner. And he is the father of behaviorism, and he is his ideas have become applied to the field, and that's what ABA is, applied behavior analysis, where we could take a look at contingencies surrounding behavior, and we can identify what is motivating behavior and also what is leading to a lack of behavior occurring. And then we can modify those contingencies, we can modify what's happening around individuals to encourage more behavior in the way that we want it to. Okay? So you think about the ABCs of behavior. You guys are familiar with ABCs of behavior? Right? Something occurs, then the behavior happens, and then there's a reason why you want to do that behavior again, right? Or not again, right? And those are the ABCs of behavior. That is something that's behavioral, right? So if we take those basic concepts and put them together into a plan, into a treatment, now we're talking about a behavioral treatment. Not everything is coming from those basics of behaviorism. Not every treatment that is effective is coming from a basics of behaviorism. And that would be a non-behavioral treatment. And that's what we're focusing on here. How do we collaborate as a team? How do we make sure we're speaking the same language? So as I've said, I worked as a school psychologist first. And full disclosure, didn't always have the highest of opinions of behavior analysts, because behavior analysis has a very specific scientific approach to the way they're doing things. The field itself has taken a big turn and recognized that we have a lot to offer, but we're lacking in how we're communicating it. And therefore, we're struggling to communicate it in a way that everybody can hear it and everybody can be on board with it. So as a field, we're responsible for really improving that and providing opportunity that we're hearing everyone else's voices so that our voices are being heard as well in a way that can be heard and not just me telling you what to do. So articles like this from Broadhead are a great step in that direction, right? As a behavior analyst, am I supposed to stand in the way and say your ideas don't work because they're not behavioral? No, that's not my job. My job is to figure out how we can work together and use this technology that you have and the technology that I have so that we're able to work together and bring the best outcomes overall. So this flow chart that we're going through is going to talk through those steps. When do I jump in and say, hey, this isn't going to work. You can't do this. It doesn't apply to my science and it's not going to help the student. And when do I say, yeah, let's keep going. Let's see where this goes. This could be interesting. Not something I would have thought of. Doesn't mean it's not going to work. Okay? So the first step is recognizing when there is a non-behavioral treatment. And this is specifically defined as any treatment that's outside the scope of traditional behavior analytic practice. So your behavior specialist is likely coming up with all different kinds of opportunities to reinforce behavior. Tickets, tokens, food, all kinds of things. Those things are based on the principle of reinforcement. You're going to do the thing that leads to the best outcome. And if I'm going to get a thing I really want for doing this, then I'm going to do it more often. Right? Why would I walk quietly in line for, potentially getting one ticket versus if I'm goofing off and all my friends are laughing at me? Right? I'm more likely to do that because that's going to elevate me socially versus the fact that I'm not going to get, there's nothing valuable in me doing it the right way, except I might get a high five from my teacher because I did the right thing. So behavior analysts are going to look at those contingencies and say, we can make the better behavior, the preferred behavior, we can make it more valuable by changing things in the environment in some way. Okay? So a non-behavioral treatment is one that's going to be based on different theories, different practices that come from outside of the scope of our field. So when do we jump in? Well, first question you got to ask about any treatment is safety at risk in any way. Okay? So is a non-behavioral treatment, the specific treatment being recommended, non-behavioral or behavioral, is it putting any kind of risk on the long-term or the short-term psychological or physical being of the individual? If yes, this student's going to be at risk if we do this, absolutely, stand up, raise your hand, stomp your feet, do what you have to do. I'm not doing this, not doing this. If you're not sure if there's a risk involved, then learn more. Talk to the colleague. Tell me more about this. How is this going to work? And if not, if there's no risk implied in this potential thing, then go with it. It's not going to hurt anybody. Let's see where we're going. How can it benefit, not just not hurt? To answer these questions, it's really helpful to become familiar with the treatment. So a great step in collaboration with anybody is starting with learning more. Right? Tell me more. Explain to me how this is going to work. It's always good, and in behavior analysis and practically any science, the first step is to remain skeptical. I didn't say cynical. I said skeptical. Okay? And that just means asking questions. Okay? Asking questions, learning more. Cynical is shutting it down. Skeptical is asking questions. I can do both really well, but let's stick with the skeptical right now. Just keep asking questions, learning more about whether this treatment is one that is worth your time and effort. BCBAs have the ethical obligation to learn more. But that obligation to learn more is not really limited to behavior analysts. Learning more about what people are suggesting is a really great way for collaboration of all kinds of professions. And how do you learn more? Well, start with the literature. Right? Go out and find some articles about it. Trusted websites. You can Google anything and get anything. Right? Let's make sure we're deferring to trusted websites that exist. And then also, really seeking advice from trusted professionals, another colleague or somebody that you've had some good experience with. Those are good places to learn more about what's being suggested and offered. And that's going to give us the best opportunity to gain the perspective of the colleagues who we're working with. Now that you've learned more, go back to that question, is safety at risk? Okay? Physical or psychological? Is there any potential for harm that exists now that I know more about what we're talking about doing here? So as I said, as behavior analysts, we're sort of ethically obligated to take a look at behavioral approaches to things first. Okay? So when a non-behavioral treatment is provided and suggested, we have the ethical obligation to think about it and compromise along the way. So the next step would be, can I take this idea, this suggestion, and can I translate it into behavioral principles? Okay? It's not something that's coming from a behavior analyst, but can it be translated into behavior analytic terminology and principles? So I'll give you an example. Again, not a PBIS example, but follow with me. Think about working with a kid who has autism who's engaging in a lot of stereotypy. Everybody familiar with what stereotypy is? Okay, so stereotypy would be making sounds or making some physical movements. Think about some kids with severe autism or general autism do that, and it's not always socially appropriate. It's something that sometimes could get in the way and distract the other kids, but it's something that is potentially soothing to the individual. It happens for all kinds of reasons, but it happens pretty often. All right? Some of it's grandiose, some of it's much smaller. In fact, a lot of us do stereotypy, whether you realize it or not, tapping your pen, bouncing your leg, things like that. Those are physical movements, things that we do that kind of help calm us, make us feel a little bit better. So thinking about a kid who does that a lot, a student who does that a lot, seeking out some support from different colleagues, and an occupational therapist suggests that maybe we should be using some tactile stimulation and doing that before academic programming. So giving them maybe a piece of Velcro and letting them touch the Velcro for a long time before we start teaching, so that maybe then they won't seek out that extra physical stimulation once the teaching has started. Right? Well, that doesn't necessarily align with ABA principles. That's not something that we would recommend. That's not an approach that we would take in ABA. Right? However, if we think about it a little bit further, right, we can find a way to translate that into ABA principles. We would call that instead an antecedent intervention that is intended to be an abolishing operation for self-stimulatory behavior. Right? So it's not an ABA intervention, but we would use our ABA terminology to say, yeah, maybe we're going to give them the opportunity to experience that reinforcement, get the feelings, the sensory stimulation done before we want them to do the thing that we want them to do, which is sit in our class and learn. Okay? So we can take this non-behavioral treatment and translate it into behavioral principles, and then feel comfortable with being able to move on. So let's think about some other non-behavioral treatments. I mean, these are probably going to be interventions. These are PBIS interventions that I've used in schools, that you probably use in your schools, that are not exactly behavior analytic in nature. Okay? So I'm going to put a couple of scenarios up here. You're welcome to talk to your neighbor to figure out where you stand on this. How can we make it more behavioral based on those ABCs of behavior? And then we're going to talk about how we can translate that, and we'll put it into poll everywhere. Okay? So here's the first one, Student of the Month. Anybody have Student of the Month at their schools? Yeah? Yeah? Great, wonderful, but it's not exactly behavioral. Okay? So you're working with a PBIS team. It's not necessarily a behavioral intervention, but an administrator suggests we need to do Student of the Month. And when we do Student of the Month, we're going to see a major decrease in disrespect towards teachers. Okay? It's not exactly behavioral. How could we translate this into behavioral principles? All right. So talk amongst yourselves. You could enter your poll in when you think you got an idea. I'll give you a couple minutes there. Give you like 30 more seconds. All right, so coming back together because we'll have more. We'll have a lot more opportunities here. Two more examples that I'm going to give you. So great comments on here. Someone might ask, how is this not behavioral, right? And I think there was a good comment that showed up here, and the reason is because it is more or less a lottery. There's no real clear, in Student of the Month, traditionally speaking, the teacher or some other person decides at random who gets that distinction of Student of the Month. There's often criteria, but very often it's subjective in nature, right? So in a behavioral approach, right, think about if you have tickets or tokens that you give out to your students, right? You see them walking in line correctly, you give them a token immediately. There's that immediate reinforcement, that immediate reason to want to do the right thing again. In Student of the Month, they might have done something really great and grandiose and fantastic earlier in the month. Then they're awarded the Student of the Month much later in time. There's no direct connection between that behavior and the award that's being provided. Not only that, but not everyone's using it the same way. Sometimes there's opportunity to help someone shine when they don't really get the chance other times. Well, that's not directly related to their behavior themselves. So that delayed contingency and that lack of consistency, that's what makes Student of the Month not behavioral. Does it make it awful? No, but it doesn't necessarily make it behavioral. So then a question came in, why wouldn't we just do it if it's not going to hurt anybody? And I think that's a good question too. But also remember that every intervention requires some level of effort and time. So the question as a behavior analyst is it, I know it's not going to hurt them, but could it hurt me in the amount of time I have to put together to decide who gets Student of the Month, the award ceremony that happens, and all the things that go along with it, creating the certificates, all that. So it may not hurt them, but there might be some other implications that go along with it. So that's why we follow through with the decision tree and deciding whether to keep going forward. Not necessarily because it's not going to hurt them, but there are other implications that come along with it. So then how do we make this behavioral? So yeah, there's ways we can change the intervention itself. Someone mentioned putting together a good structured matrix so that everybody is following the same rules along the way. That's fine. And that's a great way of doing that. But we can also recognize that this is a level of reinforcement. There is some kind of appreciation that's happening here. Not only that, but if we are reminding the students of the fact that Student of the Month is coming up, I'm still looking at everyone, how they're acting, Student of the Month can also become an antecedent intervention, where I can be prompting everybody to do the right thing by reminding of them, you know, this is going to happen, this is a great thing, if you're doing the right thing, you know, maybe we can get some Student of the Month accolades. Problem being, not everyone's going to get it. So there are some downfalls to that, there's some benefits to that, but overall we can translate some aspects of this into behaviorism, and I think I would feel comfortable moving forward with it, even though it's not a behavioral intervention. So you guys are good at this, let's do it again, okay? Here's a scenario, in fact, one that we've had some personal experience with. A teacher working in the classroom, and using tokens, maybe Class Dojo, something like that, but is now offering fines to students who do not turn in their homework. So now tokens, points are being taken away when homework is not submitted, okay? Teacher wants to do this because they believe that by taking these fines and using this kind of a system is going to lead to more homework being turned in, okay? This is not a behavioral intervention, okay? So, how can we make it behavioral? Talk amongst yourselves, think about it. Can we translate this into behaviorism? Okay, so in a behavioral, oh, sorry, go ahead, you can, I'm sorry.
So it's a punishment for increasing future behavior, which is not behavioral.
Exactly, right. So we don't punish things if we want to see things increased, right? We use reinforcement to increase things. We use punishment to decrease things. So that's a big one. Another big one is that we don't implement interventions in ABA until we understand why the behavior is occurring. So the homework's not getting turned in. Is it because it's in their bag and they just haven't given it to you? Is it because they go home to a chaotic situation and there's no opportunity to do homework because they have to be in charge of their siblings and they have to cook dinner and there's no time for homework? Is it because they don't understand the work, so they're not doing the homework because the academics are too far over their head? So to simply provide fines for a lack of homework is missing the point that there's a whole bunch of reasons why the homework isn't being turned in. So if that's the case, then we have to start looking at ways that we can use this kind of existing reinforcement to try and encourage the occurrence of the preferred behavior, having the homework turned in. And in some cases, it means letting them do the homework in school, right? Giving them opportunities to get some feedback on the content before they leave, right? So that there's chances to learn that. So this one, yeah, I mean, I would struggle with this one. I would struggle with letting it go through and translating it to behavior practice because there's potential for some harm that's happening here as well. Okay, last one, okay? Again, another one that's commonly used, was used all the time in the schools that I was working with, a social skills group, right? Lunch bunch, something like that, right? So social skills group being suggested by a counselor, wants to use it as a tier 2 intervention. The idea, if we all come together and we do a social skills training, we're going to have less aggressive behavior towards teachers moving forward. Okay? Not exactly behavioral. Okay? So, how can we make it behavioral? Can we find any behavioral aspects to this? What do you think? You can talk amongst yourselves a little bit. Last one, last example. I forgot to pull this one up, sorry. So yeah, so I'm guessing that this one's used in many schools. This one's a common one, right? This is not a bad intervention. I don't want to give that impression at all. It's just not based on behavioral principles, right? So social skills training is wonderful, it's helpful, it's really beneficial to a lot of students. It's not behavioral because it's not directly tied to the specific behavior that's mentioned here that they're trying to decrease. So again, it's offering some training on social skills, not necessarily on working on replacement behaviors for aggression or providing opportunities to learn ways to de-escalate aggression, things like that. So it's not directly tied, and that's what makes this non-behavioral. But this is not one that I'd stand in the way of because it's not related to behaviorism. This is one that I think has some really great benefits overall. It's just not something that's going to be directly tied or suggested by a behavior analyst based on behavior analytic practice. Okay. Yes.
So I know that you're so this might not be doing harm, or another intervention might not be doing harm, but what if it's delaying the onset of an effective intervention. And this is a pretty robust behavior, physical aggression towards teachers.
Oh, yeah. I don't think it should take the place of effective intervention that is going to decrease this, high priority behavior. Yeah, don't get me wrong about that. But if this is something that's going to happen at lunchtime when the behavior is not likely to occur because the teacher's not around, yeah, let's do that. But yes, if it's either a behavioral intervention to decrease this aggression behavior or lunch bunch, yes, I'm going to stand in the way of that. Yes. But if it's something that's happening as well as some other behavior analytic practice, then yes, definitely go forth and have a great time with that. But yeah, overall, I would say yes, this would be in addition to, not in replacement of. But thank you. Yeah, I should have been more clear about that. Okay. So, yes, aggressive behavior, high priority thing, we want to definitely work on that. But as far as it's not behavioral because it's not directly tied to that behavior, it's just something that could be offered in addition to, maybe as a potential extra kind of support. In the end, as behavior analysts, when you hear a non-behavioral intervention, can we tie it back to behavior practice? Very often we can, very often we can't. When do we step in the way? And the next step question would be to ask that very question that you're talking about: does this treatment interfere with the goals of the client? And if it does, then yes, step in the way. Yes, we're not going to do your behavior analytic approach. We're going to do a lunch bunch. No, I'm going to stand in the way and not be in favor of that. But if it's something that can happen alongside, that's different. So how do we do that? How do we determine that? Well, Broadhead gave us a very structured, systematic way to answer that question through the checklist for analyzing proposed treatments. It has 6 domains overall, taking a look at the function-based treatment, the skill acquisition, social outcomes, data collection, treatment integrity, and social validity. Trust me, that's what it says in these categories. And it's asking these behavior analysts to take a look at the function-based treatment, or the effect of it, and determine whether or not the probability of these components occurring within the non-behavioral treatment have a low, medium, or high probability of occurring. So will this intervention have a high probability of affecting the function of this behavior? Will it have a low probability of affecting the function of the behavior? Does it have a high probability of increasing the skill, helping them learn the appropriate skill that they should be engaging in? The social outcomes, data collection, treatment integrity, social validity, and then ultimately also taking a look at resources. Is there a high probability we have the resources to run this intervention? Yes or no? And by going through this checklist, it's just another way to determine whether or not it's going to interfere with the progress of the client, or whether or not we're able to move forward in a way that's beneficial for everyone. So this flow chart that I'm going to fly through here, this is the one I really want to make sure to focus on, because this is the most difficult time. This is, at this point in the decision tree, you have to ask, do I step in the way? Right? We've made it through all the other steps, no harm, I can tie it back to some behavioral components. Do I step in the way, or is it okay that I'm comfortable with the whole team moving forward with this? This is difficult, but with this decision tree, you have a lot of information that you've gathered. You have a lot of opportunity to really dig in and understand this intervention a little bit better, and that by this point, you should feel comfortable with your decision of, yes, it's time to stand in the way, or no, now I don't feel comfortable with moving forward with this particular intervention. Keeping in mind, though, that when you do that, there is likely to be an erosion of that collaboration. There has to be a way that we can make sure we're continuing to collaborate and we're continuing to be a good team member while still saying, I'm not comfortable. And if going through that decision tree, you've gathered that information, and now it's not just, I'm not comfortable versus, well, I fear there's a potential for harm here. I fear that this might happen. This is not directly related to things that we know will work for them. You know, if you have that information, you've gone through that decision tree, that conversation of I'm not comfortable now becomes a collection of information and not just your opinion. And that's what leads to good collaboration in the end. Just because it's non-behavioral doesn't mean it's non-effective. Just because it's non-behavioral doesn't mean it's non-evidence-based. All of these things exist. So As a behavior analyst, I'm supposed to defer to behavioral treatment as much as possible, but this is allowing me to recognize as behavior analysts that that doesn't mean this is the only way. As I mentioned before, different isn't wrong, right? And in the end, we're all together, we're all trying to reach the best outcomes for our clients and students overall. Thank you for listening to me talk for a very long time. I will now turn it over to Dr. Lanny.
All right. We're going to shift gears a little bit, although it's related to all that we've been talking about. We're going to talk a bit about treatment integrity, because that's another thing to think about. So even when you do get forward and move, select an intervention and ready to put it in place, we know we need to always consider treatment integrity with what we're doing. So I like to put it almost like in an equation. It's not as, neat and precise as this, but basically, I mean, with any decision for intervention, it starts with having an effective assessment, so you clearly know what you're targeting, whether that's an academic or social, emotional, or behavioral skill. So once you have that good, you have that good assessment data and helps pinpoint exactly what you're going to target, you then select an evidence-based intervention, or we call it an evidence-based practice, research, I don't care, whatever it is. That means that you're trying to do to address the target. And that should equal then, so hopefully, where you then go into evaluation of learner outcomes, and hopefully there's a change in the desired direction. We do, though, have to figure out, while we're considering that equals part of the equation, we have to consider the treatment integrity of that evidence-based intervention that was selected for implementation. That is definitely part of the equation. Unfortunately, sometimes that is not considered as part of the equation, and so you can't really look at evaluation of learner outcomes, which I'll talk about in a minute. But what do I mean by treatment integrity? Well, it goes by many names depending on what discipline of the field you're looking at, or different terminology. It's changed over time. When I first got introduced to it a long time ago, when I was in graduate school, it was treatment integrity, but it's now, the terms certainly have evolved. We now have treatment fidelity. We use that a lot of PBIS, intervention fidelity, procedural fidelity. There's all these different names, all kind of means the same thing, which is, can't really see that well, but it means the degree to which an intervention is implemented as planned. No matter what the intervention is. I don't care if it falls under the category of behavioral, whatever the intervention is, there should be a set way of doing it, and that treatment integrity or fidelity is going to refer to the degree to which it is implemented as it was designed by clinician, teacher, team of folks, whatever. Over time, though, that definition has kind of expanded, because what would happen a lot of times is that there was treatment integrity was kind of boiled down to adherence, which just meant, did you follow the steps of the intervention? Some interventions are set up that way. You follow steps 1, 2, 3, followed all the steps, yep, you implemented it well. That doesn't encapsulate everything that we do. There's aspects of, we talk about dosage, how often you get to the intervention. I can go in and I can observe a classroom teacher. I've spent a lot of times doing that, implementing an intervention. We talk about things. I'll say, okay, you did, steps 4 of the 4 of the 5 steps. Great. Let's reevaluate the one that might have gotten missed. Why is that? That's an adherence, but that's one observation. If that student got that intervention 1 time or 2 times, that's a dosage problem, depending on what the intervention is. Most times interventions need to be applied for a period of time. And, it might be once or twice a week, depending on what it is. Or maybe it's something every day, or it's an instructional strategy that is applied throughout the day. So that's where that definition of treatment fidelity has expanded. And Lisa Sinetti does loads of work on this, and has probably for the last 15 years. And what Sinetti and Cradwell's kind of updated the definition, although this is a little bit, it's even evolved even further, but it's the extent to which essential intervention components are delivered, still the same thing, as it's intended, trained so that it's delivered by an interventionist. That person could be a counselor, a teacher, an SLP, a school psych, whatever. But that way, the intervention is delivered by that interventionist who is trained to do so. That's the other thing, too. I've worked with a lot of people, and they said, well, I was given this paper, and I read it, and then I just did it. I'm like, well, that explains it, because you really didn't get to talk about it with anyone, nor really understand what the components were. No surprise. We've learned that in PBIS. Hey, you're new, read this manual. Okay, go ahead and do it. And then you go in the classroom, and you're like, so, there's other parts of this. Oh, I didn't even know I had to do that. Well, yeah, I understand now why, because you were given a manual on your first day and expected to read it without any other type of information on actually like being trained and having any type of professional development. So that's what we talk about with treatment integrity. So now that we kind of have this expanded understanding and definition of treatment integrity, we have to consider that when we have that assessment, that evidence-based intervention. And before we start looking at evaluation of learner outcomes, we need to consider treatment integrity. If you don't, you can't really make a conclusion about the effectiveness of the learner outcomes. Sometimes if you got the desired direction and you got the desired outcome, and you maybe don't get a sense of treatment integrity in practice, sometimes that gets pushed aside. That being said, you can't say for sure if the change was due to the actual treatment. Maybe something else happened and you're not really sure. Or other times, if treatment integrity isn't accounted for and you're not getting the change that you desire, sometimes the intervention gets faulted. When really, we don't really know if it was truly the intervention was ineffective or that the intervention wasn't implemented as it was planned. So we can't really say it was the intervention that may or may, that wasn't effective. So there's that part of it. We have to make sure that we're considering treatment integrity when we're trying to evaluate learner outcomes. And going back to the ethics code, one of the things we talk about with in behavior analysis, but again, this applies for anything, is we have to think about for treatment integrity, what are some things, like if the intervention isn't being applied or implemented as it was designed, we have to figure out why, right? So whether you're self-evaluating your own, what you're doing, because you might do that. I mean, you could be in the classroom and implementing and then go back and take a look at the intervention. You're like, ooh, I didn't complete all those parts to this. Or maybe you're observing or, problem solving with a colleague and they're not able, they're saying, well, I could do this, but I'm not able to do this part of it. So these are part of those conditions that kind of interfere. And that's part of what, as behavior analysts, we're bound by ethics code, but just general practice, you should be evaluating why it's not being, an intervention isn't being implemented as it was designed. And it could be any number of things. We call them environmental conditions, whatever you want to call them. It could be due to the behavior of others, so those who are implementing, or perhaps there's, you're in a classroom and you have lots of other students, and while the intervention on its own sounded like, yeah, sure, I could do that. I could put this in place during the day, sure. But then when you actually get in the classroom and delivering your lesson, you realize, too much, can't do it. I knew I have 22 other students in the classroom. I thought I could do it. Not going to happen. It's just not feasible. Could be hazards to the client or staff. Could be something that comes up that it ends up presenting a safety issue. I've had that too. Where you might have I spent my career more with students with emotional behavior disorders who display really significant challenging behavior. And so crisis plan could be part of their plan. And so we try and come up with a way how we can maintain safety. And sometimes what we come up with isn't right the first time. Could be other disruptions to putting in place an intervention. Could be a resource issue in terms of not having the time, kind of as I was talking about. Not having the resources that you thought you would, the materials. I can remember one of the first time, like early on in my career, and really trying to get teachers to adopt like a structured social skills curriculum, but the school had really limited funding, like all schools do. And so they had their kit that they were going to teach and they had to share it. And then when we evaluated after a few weeks, we're like, how's it going? They're like, we can't share them. We don't have enough. Like you only had, it was like scattered throughout the teachers. So we had to develop a schedule because we found out that the materials are short. There's not going to be any other funding that's going to come through that's going to purchase this curriculum, but the school was invested in doing it. So we had to come up with a schedule of how we could do it and share it. Because like just let's just see how it goes, it didn't work. Even though we thought we had a plan, it fell apart very quickly once teachers got in the classroom and tied up with their day. So those are some things like for conditions. Again, think about issues or things that could occur that would interfere with carrying out the intervention. So I'd like to hear from you. What are some conditions that you frequently see in your work? What are some things that interfere with you being carried out? Even, and this is saying with the best of intentions. You're like, I am going to do this. Or say you're working with someone else and your colleague's like, yeah, I can do this. But then when it actually comes into practice, you find out, ooh, wasn't so easy as I thought. As you can see, it's generating word cloud. I'll just give it another few seconds to see. Time is front and center. If you're not familiar with word clouds, it's the words or phrases that are bigger, bolder, are the ones that are more frequently endorsed by people who are completing in this case, the poll. Okay, so as I said, time, not surprised. Money, always funding, and that's a common concern for sure. Collaboration, we have budget, there's crises that interfere even with your best plans. You can have crises that would certainly interfere, and those are always unplanned. Shortages, certainly having consistency. An understanding, I might presume you might mean an understanding of the intervention. I'm going to talk about that in a minute. Shortage. I see some things that kind of relate to attitudes, like a mindset and cynical, so what people understand about the intervention and what their approach is, maybe to address it. Okay, unscheduled. Okay, all right. Okay. Truancy. Okay, safe. All right, so good. So, yeah, these are common kind of conditions that are part of the work that you do. So, anytime you're trying to think about doing something differently, in schools, we always think about doing something differently. Always means what a lot of times it gets interpreted as is layering on top of what I'm already doing. I never go that way. I'm like, no, you have to discontinue something that isn't working, so replace it with something that potentially will hopefully have a higher degree of effectiveness. And ideally, it's going to work better than the previous. But we're not trying to necessarily layer on something else. So when we think about like treatment integrity kind of things for interventions, it kind of falls into two buckets. One being drift, we call it about, which is really just unknowingly deviating from what the original intervention is, and it truly a lot of times is drift. Sometimes it's complete, I'm not doing it anymore, it's discontinue. But a lot of times what happens is the drift, it slowly just drifts off. You do part of it, you do most of it, and then over time you do some of it, and then it's very little, and then after a while there's really no observable evidence of the intervention ever being put in place. And by that I mean like actually the intervention parts. And then there's kind of adaptation. Because anytime you take an evidence-based intervention from anything you might read about, whether it's something that was written, or written up in a peer-reviewed journal, or perhaps somebody tries to sell you on something, maybe it does have great evidence behind it, most times it does require some level of adaptation for your context, for your students, for your staff, for the resources that are available, any of those number of things. And those are usually done. We try and anticipate as many of those barriers from the beginning, so those are conscious changes to the intervention. So planning ahead of time, whether you're going to look at the key programmatic content and adding, changing, or omitting things, and that's, again, done consciously and planfully. And I always caution people, just to make sure that you're still keeping in the elements that are the key treatment ingredients. That's part of it, but sometimes, again, you have to think about that. Those adaptation, other times it could be changing a little bit of the method or style or context of delivery. And there's always a little bit of a delicate balance of how much are you changing so much that it doesn't really resemble actually the evidence-based intervention, then you're getting a little too far away. And there isn't a clear formula on how to do that. You do just have to be mindful of that as you're doing these kinds of things. The sequence or frequency of the intervention, again, we talked about that in terms of dosage, so you have to think about the frequency and how you're going to be able to do that. Are you trying to be reach the optimal dosage as according to what's recommended in light of what you're actually able to do in your setting? And then certainly target population. You're always trying to select an evidence-based intervention that has been tested out with populations that are closest to who you serve in your setting. We don't always have that luxury, so you try and get as close as possible, so that way you'll increase the likelihood of the intervention being effective. But again, so any of these adaptations, they're done purposefully or planfully, either prior to implementation, you can plan out this as much as possible, or perhaps after the fact when you're looking at the integrity and kind of realizing you're not putting in place all the pieces of it or the parts of it, and now trying to respond to barriers after implementation. So you realize, okay, these are the barriers that we're encountering. Think about those conditions that we talked about, or that you just populated the word cloud with, and now trying to make changes to those in light of those barriers. But again, it's depending on what type of intervention, it's, if it's something related to a tier 1 system, that's a team coming together and making a decision in light of the barriers, and trying to then make those adaptations to the intervention with the understanding that the teachers are probably already making adaptations, so trying to harness all that information together and saying, okay, we already know that lots of teachers are doing it this way. How are we going to address it? Do we need to, we need to get some information, figure out why they're doing that. What is it? Is it related to any of these conditions that we talked about that we didn't account for sufficiently in the beginning, and now we need to? And then say, okay, come up with a plan as a team. That could be part of your decision-making process. That's great. That could be. So at least you have a better idea of what's being done at a tier 1 system. Same could be done at tier 2, tier 3, but it's obviously on a smaller scale, so it's sometimes easier to kind of pull all that together. Tier 1's a bigger beast. You got a lot more people, a lot more students involved. So you need to get a better handle on that. And that's really where you lean on your team, because they're they're representative of your group, of your stakeholders. They represent the voices across your context, across your setting, your school, and then hopefully they have an ear of what's going on. And so you can then make adjustments there accordingly. So there's been a few different ways to think about improving treatment integrity. One, and I'm going to touch on, well, I'll try and get through as much as I can of this. I'm just going to talk through these things. So one is selecting programs carefully. So as I said, you want to try and select a program or an intervention, whatever it is, your means of trying to change things. You want to make sure it's matched to the specific needs of your community as best as possible. And when doing that, you want to look at the evidence of how well it's been supported and been effective, because your time's limited. You want to try, rather than trying to reinvent the wheel and create something brand new, why don't you rely on the people who that's what they're supposed to be doing for a living, and trying these things out in schools and then reporting the evidence. And then you can rely on that and determine, okay, what's the evidence base look like? What's the fit look like for our school and our resources, who we serve? If if all the research is done in rural districts in Midwest, and like a lot of the research I did was in inner city Philadelphia with many, many more students, that may not be the best evidence-based and may not be the good fit, because right now, we don't have the evidence just yet to support or show it being done in this context. And that's okay. And then we also think about feasibility. If the intervention's great, evidence is great, fit seems good, but it's expensive, it's not going to be feasible. And the school doesn't have the funding for it, it's not going to be feasible. It's, you know, and sometimes those are the decisions that need to be made. When we think about high quality of implementation of any change, it requires really a clear understanding of what's involved in that. That's why we spend a lot of time, like when we're starting out with PBIS, providing a lot of the background and the rationale, because as a lot of you mentioned, around some attitudes related to behavior change that might be in place, because we're trying to change the behavior of the adults to in turn impact the kids, right? So if we have those who have a mindset that may not be in support of what we're trying to do, or perhaps, as someone wrote, cynical, maybe some attitudes, things like that, those are barriers. And that might mean that you need to take take some more time to make sure that those who are implementing have a clear understanding of how this intervention is supposed to address the problems. If they don't, if your implementers really don't understand that, you need to spend more time there. Because what will happen is they won't implement because they don't really see the purpose. And there isn't, again, it'll depend on who your staff are and where they are in this whole process and their willingness to kind of engage in this type of intervention planning. The next one is about assessing readiness for implementation. This should really be done in the beginning. When I started doing PBIS work in 2003, we used to just go to schools and be like, hey, you want to try this out? Sure. Because I worked for a nonprofit, we had a little bit of funding. We'd say, hey, we're going to do this, we're going to support you. School would be like, sure. And then we get into it and they were like, we didn't know we had to do all this. I'm like, yeah, I guess we should have had a readiness, right? To tell you actually what's involved. I mean, we gave our little spiel, but we really needed to get into a lot more around resources and what's involved, what kind of changes are going to do. Like, hey, we're going to do the training, but your staff are going to be responsible for doing this. And so we've learned a lot in doing PBIS work. And that's why we have readiness checklists, right? Now, if the school's not ready, don't start, because it's not going to work from the beginning, right? So it's whether you're doing it at a tier 1 level, or I've done a lot of work with teachers. The teachers aren't ready to move, then I need to spend more time there and get a better understanding of how their classroom works. So maybe we can collaboratively identify interventions that are going to better fit that context. So that's why you can't always take that intervention directly from research and apply it exactly as it was implemented in the article. You might have to say, okay, what are the key treatment ingredients, and then how can we put this in place in this classroom or in this small group? Then we also have to think about making sure we're planning ahead of time before implementation. That's done before implementation, but also after the fact and ongoing. So when you do assess for treatment integrity periodically, that you're taking a look at what's working and what's not working, and you might need to go back and replan a little bit. Because there could be things that were unanticipated. It's not could be, that always happens. There's always barriers that come up that are unanticipated. And so you might need to go back and take a look at what exactly do we need to clarify? What do we need to think about that we hadn't considered before? Those are some of those, think about those as those environmental those conditions that occur that disrupt kind of implementation. And then we have a couple more here. So like developing an infrastructure for quality improvement. So having that way to make sure that there's that ongoing assessment of treatment integrity. And so that could be done across a tier. So, we do a lot with the TFI and then BOQ for schools that are just starting out with tier 1, and then tier 2, tier 3. Sometimes some of the interventions already have built-in kind of fidelity or treatment integrity measures. If you can, sometimes you might have to develop one or tweak one to make sure you're getting a sense of how well the intervention is being implemented. And then finally, and we know this like the back of our heart, like the back of our hand, is about a public health approach. And that's just, and some of this work comes out of like the psychology literature, because you can have psychologists who work one-on-one with individuals, and now it's trying to tie it to kind of a bigger context. But again, we're already very familiar with that with a public health approach. So if we put that in the sense of these concentric circles, as we think about this for treatment integrity. So I've been mentioning a lot around practices as terms of those evidence-based interventions. And that's what we know. We're trying to put those in place so that we can support student behavior. But all about treatment integrity relates to systems to support the staff, right? That's what we're trying to do. Because we know any practice is only as good as well as is being implemented by staff. And if staff aren't supported, it's not going to go anywhere. The best of practices you're not going to achieve those desired outcomes around social competence and academic achievement. All right, so with that, this is our last poll, I promise, because there's only a few minutes left anyway. But here's, I'll just give you a second to read this example, and I want you to think about, and then we'll do a quick poll, and the options are listed at the bottom, but I'll give you a sec to read this. Okay, sorry. I always forget that. I'm gonna try and, oh no, I don't need to do that, sorry. I thought they were gonna pop up. The one wasn't showing up. Sorry, I'm messing around with this, and it's the end of, not the time to do it. Oh, I can't see the bottom one. What's the one? All right, so it looks like assess readiness for implementation is the front runner here. And I mean, there isn't like one answer that's like desired for this, because there's a few different ways to kind of tackle this. The example was such that, yeah, of course the school wants to move to tier 2, right? Like, that's what they feel like. We've been doing this for a few years. Like, look, it's been several years. We should be moving on. Sounds like it needs a little reset, right? So that absolutely might be an opportunity to assess readiness for implementation. You could have had not only a staff shortage, but some staff turnover that you might need to take some time to reassess for readiness for implementation. See where everyone's at with all of this. And then developing an infrastructure for quality improvement. That could be, you already got this TFI score where it's identifying that there's problems. So then thinking about how can we maybe do some ongoing kind of quality improvement and getting some information from teachers about that, or how can we get some feedback to teachers more frequently? That could be part of the quality improvement. And then also maybe thinking about planning formally before implementation. The before is kind of out of this. We're now mid-implementation. So maybe now getting that info from teachers and your staff about what's up, like what do we do, what's going on, what are you having difficulty with, what can we try and make some adjustments to, because what we planned prior to the pandemic isn't working now. And why is that? Maybe it could be a little bit of a mindset. Maybe we need to do that, readiness for implementation, but we also need to seriously consider what are those barriers that are in place now. or present now that maybe weren't present prior to implementation when we were sailing and, doing well with recognition. So those are always things to think about, and there isn't always one way to tackle a problem with treatment integrity. But I think what we learned from all the PBIS work is that we don't want to necessarily just take an individual approach, or certainly don't want to make the assumption that someone's not implementing because they simply don't want to. There's other issues that we need to dive deeper about why that is. It's more than just saying, well, just do it. They're not, for whatever reason. It's part of, it could be your colleague, it could be your neighbor, your teacher, the next classroom over. So maybe you do something a little bit at a grade group level. How do we figure this out? Maybe depending on your role, maybe you're consulting, whatever it is, but it's trying to dig into why. Oh, there's like no time left. So I am going to skip all this for now, and I'm just going to think, I just want to bring this back to like decision making. A lot of what we were talking about today is around decision making, and the decisions that we make, whether on individually or as a team, they're being influenced by other factors. Not only are we trying to plan for our colleagues and staff and educators, but our decision making is being influenced. So we know that if we have more time, we have better and more information. If we get more background and maybe some expertise, as well as when we have a little bit more resources, that can lead to better decisions. So don't ever feel like you need to make a snap decision. Very few things. I mean, there are some specific circumstances where you need to make a decision on the spot, and that's usually around safety issues. Everything else takes some time. Take some time to think and reflect, and then that will lead to better decision making. All right. Well, thank you, everyone, for your attention today. It was great. We hope you enjoyed the conference. Safe travels, and we wish you all the best. And here's our contact information. Feel free to reach out if you have any questions at any point.